Happy Halloween. Thank you for being here for Compassion Chat. My name is Marshall. I am the author of Mom's Gone Missing: When a Parent Changed Life Upends Yours, and your host for Compassion Chats. We get together the fourth Tuesday of every month. This month is an exception for a number of reasons, but thank you for joining us. Thanks for making the adjustment with us. We started Compassion Chats to bring not only agencies that help caregivers, primarily of dementia and Alzheimer's sufferers, but the people behind the agencies who care for each one of us. We thought probably easier for us to pick up the phone and look for some help when we actually put names with agencies and faces and voices with names. So that's why we're here on Compassion Chats. Again, thank you for joining us. This chat will be recorded, as they all have been. You can find the archive of all of our Compassion Chats going back to the beginning at susanamarshall.com. Tonight, I am absolutely delighted and privileged, actually, to introduce our guest, Ingrid Kundinger. Ingrid is the Senior Medicare Patrol Program Director for the Greater Wisconsin Agency on Aging Resources. Whew, that's a mouthful. Ingrid, thank you so much for joining us. Welcome.
Thank you. Thank you so much for having me. I appreciate this opportunity.
We like to start our chats by getting to know our guests a little bit. So give a little bit of your background and what brought you to the work that you're currently doing.
Sure. Well, as you said, my name is Ingrid Kundinger, and I am a lifelong Wisconsin resident and have dedicated most of my professional career to working with older adults in one way or another. So I can't really explain why that is, but that has always been something, that population has been a population that I've been drawn to and am privileged to have worked in a number of different agencies and organizations that support older adults. I have worked in nonprofit organizations raising important funds and mission support for organizations. I spent some time in long-term care as the director of several memory care units, so I am familiar with some of the issues that do impact not only people with dementia, but people who are providing care for them. And then most recently had joined the team at the Senior Medicare Patrol here in Wisconsin, and this gave me an opportunity to be out and about interacting with older adults, as well as providing some important support and resources to people for something that maybe people don't necessarily think of as it relates to Medicare related fraud and scams and all of those things, which we'll talk more about. So I guess bottom line, it's always been really important for me to work with older adults in some capacity, and I'm certainly happy to be doing that in this role currently.
Wonderful. Well, tell us a little bit about the Senior Medicare Patrol. How is that different from so many of the agencies that work with the aging population?
So the Senior Medicare Patrol Program is a nationwide program, and we are funded through the Administration for Community Living, which is a subset of the U.S. Department of Health and Human Services. And there is a Senior Medicare Patrol program in all 50 states, as well as the 4 U.S. territories. I think one of the things that sets this program apart from other agencies or organizations that provide support to people who are older is that we're pretty specifically focused on Medicare-related fraud, errors, and abuse. And as our mission dictates our work, we really focus on empowering and educating both Medicare beneficiaries as well as their caregivers and advocates about how they can protect themselves from getting into any sort of trouble related to Medicare-related fraud to begin with, as well as ways that they might be able to detect if something's happening or has happened. And then we also provide a way for people to report concerns as it relates to that. We operate a toll-free helpline. where people with Medicare or their advocates or caregivers can call to say, hey, we just got a really weird phone call, or hey, you're never going to believe what just happened. Somebody called me. They said they were from Medicare. I shared my Medicare number, and now I'm thinking maybe that wasn't a good idea. And the list goes on and on. So I think that we're probably not a very well-known resource, which is another reason why I'm really thrilled to be able to be a part of this chat this evening, just to share with more people who we are, what we do, and how people can connect with us.
That's fantastic. And that is exactly why we do our chats. Let's dive into this, Ingrid. Fraud, we all know, is growing in a very frighteningly fast manner. So when you talk about Medicare specifically and healthcare fraud, can you give us a couple of examples that are likely to occur?
Absolutely. So first of all, I want to let everyone know, maybe you're not aware, but Medicare-related fraud, errors, and abuse are estimated to cost the Medicare program about $60 billion on an annual basis. And that wasn't that, yes, that was billion with a B, not million with an M. So it's a huge problem that many people probably are not even aware of. So $60 billion. That's why we have this program, and that's why we're continuing to spread the word. But some examples of Medicare related fraud would be, like I said earlier, someone contacts you and asks you if you have any pain or if you need any sort of medical equipment. They're going to ask for your Medicare number to verify that, and then they're going to get something for you to help with pain or whatever that might be. And what happens then is they have access to your Medicare information. So the fraudsters or the companies that are not acting ethically, whomever that might be, they are looking for ways to submit claims to Medicare for payment without needing to provide a service or without needing to provide a quality service. So what that oftentimes might look like, the most popular, for lack of a better word, which we certainly don't want to have favorites, but there is one sort of Medicare fraud that's pretty common and kind of rotates through the cycle, is related to durable medical equipment, or DME as it's often referred to. And what that is like the back braces or the knee braces or the elbow braces or you can do the whole head, shoulders, knees, and toes, all the different things that could have a brace. They want to try and connect you with that, offering that it's free, that Medicare is going to pay for it. Again, just needing to verify that Medicare information. And so what happens then is, if they called me and they identified themselves as calling on behalf of Medicare or as a Medicare contractor, they're using language that makes me feel like that's legitimate. And wow, these people really want to make sure that I have this equipment and it's free. I mean, we all like stuff that's free, right? So that's a great thing. And so I'm quick to find my information and share that with them. And then what happens is that I may or may not receive whatever sort of equipment I was talking with them about, but most definitely Medicare is going to be sent a claim for that. And when I first started in this position, I thought $60 billion, like, I don't know, that seems kind of like a lot, but quickly realized that these things add up. And, I spoke with a gentleman from the southwestern part of the state, kind of to tie up this example for you, is that he called our toll-free helpline and he said, "You are never going to believe what happened to me." I often get that on the phone, and I'm always interested to see what story I might hear as a result of that. And he was a gentleman who had back issues, and so he oftentimes was not able to sleep at night. And he continued to see a television commercial that played late at night that was offering him this back brace that was going to be the best ever. It was going to solve all his problems. It was going to be free. And he said, after a few nights of not being able to sleep and constantly seeing this commercial, he decided to call the 1-800 number and see what that was all about. So then a couple days later, he received 7 boxes of equipment. So not just a back brace, but all the braces, knees and ankles and shoulders, and anything that can have a brace, he got something for. All different sizes, didn't matter. He was very upset. He hasn't contacted us yet. Packaged everything back up, took it to the post office, sent it back, spent his money to do that, and thought it was over. Like, okay, done. I didn't do that. I'm not going to do that again. I don't have any of these things. I don't have to deal with this. Then when his Medicare statements caught up with him, he realized when opening those Medicare statements that Medicare not only had been submitted claims for that, but had made payments on all of those things to the tune of about $30,000 just for that one gentleman. So that's when I started to realize that this number of 60 billion probably, unfortunately, was accurate, and disgusting, for lack of a better word, that is how that happens. So, because of the way that this program works, we were able to work with that individual and got copies of all of the paperwork that he had received, as well as the receipts that indicated that he had, in fact, returned all of this equipment. And we submit, as the Senior Medicare Patrol, we're not investigators in this suspected fraud, but rather we are more the information collectors. So we did all that we could to work with this gentleman to collect the facts and kind of his side of the story, as well as the documentation to support that. And then what we do is we send that off to the Federal Office of Inspector General, and that's where they take over in the investigation. And it takes a while, and it's not an easy process in terms of us finding out quickly what's happening, but I think it's really important because they do spend the time to investigate, and they do eventually catch up with these fraudsters, and people lose medical licenses, companies are no longer in business or are no longer able to submit claims to Medicare, people spend time in federal prison, and a lot of their fancy things are taken from them that they've used with the Medicare money, and Medicare is then able to recover some of the monies that they shouldn't have had to spend in the first place. So that's just one example. And I think I don't want people. Yeah, I don't want people to get the wrong impression about medical equipment or this durable medical equipment, because it absolutely can be helpful, and it absolutely is covered in most cases by Medicare, or at least partially covered. The thing that's missing in this whole story is that it's best, or the only way that it's done legally, is that you speak directly with your healthcare provider, and you have a relationship with him or her. You talk to them about whether this could be something that could benefit you, and then you get an order for that, and they recommend a local, more than likely, durable medical equipment company, and it's all fine and good, and Medicare gets the bill, they make the payment, and that's how it should be. It's just when you're contacted out of the blue, or you respond to the television commercials, that sometimes that's where the people get involved that are not necessarily looking out for your best interest, but rather looking to line their pockets with money from Medicare, unfortunately.
Well, and this is really scary, Ingrid, because some of the United Healthcare, for example, has supplemental Medicare programs. I have gotten calls saying, hey, we have home visitation service. We want to come to you. I always ignore them. I've got a primary care physician miles away. How is anyone to judge what is legitimate and what is not?
Yeah, that's kind of the million-dollar question. And unfortunately, there's just a lot of misleading and sometimes borderline fraudulent activity that happens that makes it really hard to know what's legitimate and what's not. So from our standpoint, we want to make sure people know that we can be a resource. We often encourage people to connect with their local aging and disability resource centers. They have a team of staff that are excellent resources, especially when it comes to enrolling in Medicare to begin with, or making changes to your Medicare plans or your Part D prescription drug plans during the open enrollment period, which we're in right now. There's a lot of people, unfortunately, in this world that we live in, and this isn't even direct, only related to Medicare related fraud. I mean, there are gazillions, maybe that's a little bit of an exaggeration, but many different fraud scam tactics that people, in the line of work that we do, we hear stories about all sorts of things: the grandparent scam, the romance scams, the computer malware, virus protection scams, the car warranty scams, the student loans for people who paid their student loans off 60 years ago, but yet they're getting phone calls about that stuff. So, we really want to be ahead of that and just really encourage people to be careful. Be careful on the phone. You reference the phone calls. If you don't recognize the phone number, we encourage people to just let it ring. And I know it's annoying to listen to a phone ring and ring and ring, but it could save you some hassle in the long run. And I know for people who are providing care to other individuals, especially with memory issues, that's sometimes hard. And, in the world that we live in, we can't take everyone at their word or for who they say they are. And I really hate to say that. That's a really sad thing to have to say, but that's true. And so, when someone says they're calling on behalf of Medicare, they're not. Medicare does not call people. Like 99.9% of the time, Medicare is not calling you, nor is the Social Security Administration or the Internal Revenue Service. And so, people of a certain generation, or they just assume that if that's who says they're calling, that's legitimate, and that's who that says they're calling, and whatever they've asked them to provide, they're going to do it because it's a government agency. Sometimes the fraudsters are threatening people or saying that your benefits are going to be cut off if you don't adhere to whatever I'm asking for you, or that you're going to be non-compliant with your healthcare provider. Like, those threats are empty threats, but sometimes people don't know that.
Well, and worse, not only don't know it, but feel coerced because, to your point, Ingrid, I'm from the government, or I'm from Medicare, or I'm from this agency everybody knows, and without being paranoid, wants to trust. So when that happens, what is your best advice? Call your provider, call a family member, help us take that next step.
Sure. In terms of if people get those sorts of phone calls, or if they feel that they're being, tell someone. We always encourage people to tell someone about that. Tell a family member. If it's related to Medicare, reach out to the Senior Medicare Patrol Program. If it's related to other health insurance, connect with the Aging and Disability Resource Center, and start there, because those are kind of one-stop shops. We will listen to whatever your concerns are, and if it's not us that can help you best, but there's someone else that we can be a great referral service. I think what's most important is that people report that. Oftentimes if people fall victim, maybe that's not the right word, but get involved in some sort of a scam, and then they realize it, they're kind of embarrassed and they don't want to talk about it. They don't want to share it. They just don't say anything. And, we aren't judging people. It happens to everyday people every single day. And so we want to make sure that we can make sure that your Medicare account is going to be safe. So if you've shared your Medicare information, or you feel that maybe your loved one or the person you're providing care to has shared their Medicare information over the phone, there's ways to get a new Medicare card or a new Medicare number. And if you connect with us, we can walk you through the steps to do that, to make sure that if someone who shouldn't have that information does have it, that we can end that, so that if they continue to submit claims to Medicare, eventually they'll be denied because you will have a new number that hopefully they won't have access to. So most importantly, tell someone. If oftentimes how you would detect if there were issues, if maybe mom or dad or whomever you're providing care to doesn't say much about those sorts of things, but maybe you open a closet and find all sorts of boxes of medical equipment that were kind of just put in there because they weren't quite sure what to do. You can call us. We can talk through what might happen next with that, or how to get it out of the closet so you can use it as a real closet. And also to just be more aware of the statements that are coming, to make sure that's where you're going to see if there were claims that were submitted that are suspicious. That's where you're going to notice that. And so if you do, again, notice a claim that's coming from a provider in North Carolina, and you or your loved one has never been in North Carolina, nor have you ever received care or support from a company in North Carolina, that's probably sketchy. We can probably help you do something about that. So just being aware of, what to look for, what to think about, what to watch for, that could be helpful to people as it relates to this Medicare related fraud.
That's very reassuring to know that we can pick up the phone and say, hey, I think I messed up, right? Mm-hmm. Can you help me?
Yep. And that's the kind of calls we get on a regular basis. People are, oh my gosh, I can't believe I did this. I knew that I shouldn't do this. Everyone's always said, don't share your Medicare information over the phone. But there was just one thing that the person said that really made someone think that it was legitimate. Or sometimes people call and say, I was just waking up from a nap, or I wasn't feeling good today, or they just caught me on an off day. And you know what? That's what they're looking for. That's what the fraudsters are looking for. They're looking for to catch you on an off day, or to unfortunately catch someone who's extremely isolated or lonely. They strike up a conversation. They're asking questions about, how are your grandkids? How's the weather where you live? Who knows what the other questions are? But that's someone to talk to. Maybe they're really lonely. And so suddenly, once they start talking about bank account information or credit card information or Medicare or other insurance information or a social security number, someone might think that that's legitimate, and they're quick to go and get that information so that they can continue to have that conversation with that individual.
So let's talk, Ingrid, about Medicare and healthcare abuse. Is that a legal term? And how do you differentiate that from fraud?
So fraud would be intentionally doing something to defraud the Medicare system. So there's definitely intent meant there. So when these companies are calling people asking for their Medicare information, they are fully intending to submit a claim to Medicare for payment for something they may not even provide to that person, or that it's not going to be a legitimate or appropriate product. Abuse is a little bit different in that doesn't necessarily start out with the intent of that, but there's, maybe it started as a billing error. It was an error, and it was not done intentionally. We're all human. The health coding system for health insurance is kind of crazy, and it means that someone at a computer is keying in things, and we're human. We make mistakes. So maybe it started out as a mistake, but they quickly realize maybe that people aren't catching the mistake, and that if they are using a different code, they're being reimbursed at a higher rate. And so it kind of starts out somewhat innocently, but unfortunately, there's healthcare organizations that are more focused on their bottom line than doing the right thing. And so that's kind of where that snowballs. And had someone noticed that it was an error, they could have called and had it corrected. But if it goes unnoticed, no one's ever going to ask them. And so the fraudsters are really hoping that people don't look at their statements, because then you're never saying, wait a minute, I didn't get 3 flu shots on that day that I went to the doctor. I only got 1. Why did Medicare pay for 3? And calling them out on that. If no one does, they'll keep trying, and then, decide if someone does finally call and ask the question, then they can make changes to that or correct that.
So how would you know if the statements themselves are not always easy to understand, or, for example, if you go see a doctor and there's blood work performed, for example, or an x-ray taken, mammograms you get billed by several different entities in the healthcare system. How would you know when there is abuse, A, or B, even an error?
Well, if you're someone who's on Medicare, if you have original Medicare, which is parts A and B directly from the government, you would receive on a quarterly basis. If you haven't signed up for an account online, and you certainly can sign up for an account online and have access to the statement information as well as other information much more quickly. But if you are receiving paper statements, you're going to get a quarterly statement that's called a Medicare summary notice. So that is going to provide, it's a statement, it's not a bill, but it does provide information of every single claim that was submitted with your Medicare number during that 3-month period. So even if Medicare doesn't cover the full cost of some of the things that are submitted, it's going to say who submitted the claim, what the doctor or the healthcare provider's name is, what the date of that service was, and then it's going to use some of the techie medical jargon that we might not understand as lay people, what those services were, and then what the amount that Medicare was billed, the amount that Medicare approved, the amount that Medicare paid, and then if there's any other payment that would be required outside of what Medicare covered, it would outline that as well. So you would know for sure that all of that information went through Medicare. If you have a Medicare Advantage plan, which means that you've decided that you are going to work privately with an insurance company. You mentioned United Healthcare earlier, Susan. That would be one example, versus getting directly health insurance from Medicare at the government level, and you decide to have a Medicare Advantage plan, you're going to get a similar statement. It's going to be called the explanation of benefits statement. And again, that's going to be something that comes to you either in the mail, or I'm guessing most Medicare Advantage plans also provide an electronic option of that. And again, that is going to provide you with an overview of all of the services or things that were submitted as a claim. So even if you're someone that's not yet on Medicare, like myself, when I go to the clinic for things, like I get an explanation of benefits statement. So part of our messaging too is that it doesn't matter how old you are. It's important for all of us to be conscientious healthcare consumers and make sure that we're taking the time to review those statements every time they come, so that we can make sure that they're an accurate reflection of the healthcare that we actually received. And if they're not, that we can take steps to file claims, make appeals, whatever it takes, contact the provider to get either further explanations for what those claims are, or to report them as suspicious and have investigations happen related to them.
Well, so I don't know how to do that, right? If I find an error, or I'm a caregiver and I'm noticing on my loved one, my mom, my dad, spouse, whatever, that there's some stuff that I don't remember or just doesn't seem right. Now, what do I do?
Sure. Well, if you're comfortable calling the provider to ask for more information, you absolutely can do that. If you'd rather, you can also just call the Senior Medicare Patrol. We can talk through those things with you. If you've never called the provider before and you're not sure what questions to ask, or you're just not quite sure, we can talk through some of those things. If it's a situation where we need to call Medicare to get some clarification, if you, again, that can be kind of intimidating as well. And if you've not ever made a call to Medicare before, we can do that with you, or we can do that on your behalf. We would have to collect some additional information from you to be able to do that, but we can help interface with those folks to help you better understand what's going on, or to then decide if something is not quite right, to figure out what our game plan is going to be to get it reported and corrected.
So let's kind of walk through a scenario that I know many caregivers have experienced. You're helping mom, you're helping dad. They don't want anybody in their business. They don't want, so if you notice something that doesn't seem right, they say, don't worry about it. It's fine. How do you get involved, Ingrid, helping caregivers work with the ones they're caring for to kind of navigate that conversation?
Yes and no. I mean, I think it's a tricky spot, as all caregivers know. I mean, those are uncomfortable conversations to have with your mom or dad, and that's never an easy thing. But we can certainly kind of brainstorm with people what those things might look like. I mean, oftentimes, we often get calls from adult children or other caregivers around the holidays. Maybe they don't live near mom or dad, but they come home for the holidays, and that's when they're just reviewing paperwork and notice, like, wait a minute, something is not going right. Or, as I said earlier, they open the front closet and boxes of medical supplies or diabetes supplies or who knows what comes tumbling out. And when asking mom or dad, what is this? Like you said, oh, it's nothing. I don't know where it came from, but I'm just saving it. I might need it someday. And just I think the most important thing is to not make them feel threatened or like they did something wrong, because, like I said, this stuff happens to people, everyday people, every single day. It doesn't matter how educated people are, what their status is as it relates to wealth or it doesn't matter. These fraudsters don't care what political background you have, what your profession is, what they don't care what your retirement status is. They are just looking for that information, and they will do whatever it takes to do that. I've had some caregivers that have shared like that they have been sharing with their parents, like, oh my gosh, mom, you're never going to believe it, but I got this crazy phone call the other day, and like I almost shared information that I shouldn't have, hoping that maybe that would open the door, like, hey, this happened to me, where then you could have that conversation of either, have you ever gotten these crazy phone calls with people asking for personal information, which then maybe would provide an opportunity to, that was a great reminder to me that it's really important that I don't ever share this, Medicare information, Social Security information, bank account information, credit card information, all those different personal information. Just an important reminder. I know in some cases, that's going to go in one year and out the other for a variety of reasons. And, there's only so and so much you can do, but to just try to have that open dialogue, and then just, to check in every once in a while. And if you have to use yourself as the, like, oh my gosh, I got this, I looked at my statement and all of a sudden there were these things on there and I didn't understand what it was, but I made some phone calls, I got it figured out. Like, maybe we could look at your statements and make sure that it's all fine too. Because a lot of times people don't report it, A, because they're embarrassed, or B, it didn't necessarily force them to have to write a check at the moment. Like, they don't have to pay for it now. We obviously are paying into the Medicare program now, or did while they were working or their spouse was working. So, but they don't think it's a big deal because, Medicare paid for it, but I personally didn't have to pay for it. So just, reviewing those things together just to make sure everything is okay. And then just making that part of a general, like once a quarter or every 6 months or every time we visit, or in some cases it's been like, you know what, mom, I'm going to just take over. I'd really like to I'll take these for you. I know they're confusing. Let me, take the lead on that. And if there's any questions that I have for you, I'll ask or verify dates or that sort of thing. So, sometimes that could be helpful. We also have a resource. I'll hold one up here. It's called a My Healthcare Tracker. And this is just a small little booklet, as you can see, which is something that we encourage people to take with them to doctor's appointments, not to capture all of the details that happen during a doctor's appointment, but to just capture the basics. So what that means would be October 31st, I went to the doctor, I saw Dr. Smith. So I'm writing in my healthcare tracker, like 10/31/23, I saw Dr. Smith and I got a flu shot. So I just wrote that on there, and then I just put this back wherever I keep it. And then when I get my statement, because my statement might not come till maybe early January, and I don't always remember specific dates and that sort of thing. But now I've got my tracker and I have my statement, and then I can kind of walk through. Yep, here's that 10/31 Dr. Smith flu shot. It probably doesn't say flu shot. It says the fancy medical jargon for that, but we can probably get through that. And then at least I know that that's an act like that matches. And so if people are interested in this, we've had feedback from caregivers that say it's been helpful if there's multiple siblings or people that are taking mom or dad or loved one to doctor's appointments, that this becomes important, that they all know that this is something that goes with every time, so that whomever's going next time has the most accurate records of that. So if people are interested in that, or just as a possible resource, they can reach out to us and we can provide that at no cost as a way to help them with that.
That is a fantastic resource. Do you also have an electronic version? I'm thinking about siblings who may be in other parts of the country, as you said, come home for the holidays, maybe share those things that may not have access to the actual hard copy.
We're working on that because we have had a request for that. So at this point, it's not 100% ready, but we will have access to that, and we will make that available on our website. And in the meantime, we are certainly do have the paper copies that people could, request from us to use. And, if you request it and it's seems like, oh, this isn't what I'm looking for, share it with someone else who might be able to use that resource as well. And there's some important phone numbers in there as well in terms of how to connect with the Senior Medicare Patrol, with Medicare directly, with the Aging and Disability Resource Centers across the state, and some other resources. So it also has some of that important information as well.
I'd like to ask about a caregiver in the role of caring for an Alzheimer's or dementia patient. You mentioned earlier an online account with Social Security, some of those providers. How would you go about doing that, A? And B, is that advisable given the levels of fraud we talked about earlier?
Sure. So if you have those accounts set up with either the Social Security Administration or Medicare, those are directly from those government websites. So we don't see fraud because people have accounts on those websites. So I think that they're pretty safe. I mean, that's not something that unless there was a major data breach, which I guess never say never, because we hear reports of that often. But that information would be private and not something that would be available to everyone. You have to create a password and a username to be able to secure that information. And as far as the first part of your question, is it related to adult children or someone, providing care to someone, you certainly could set up an account on behalf of someone if you wanted to. If you're calling Medicare directly to get information, they will either ask, if you're not their healthcare power of attorney, they will ask to speak to mom or dad or whomever you're providing care to get permission from them to then continue to have the conversation that you called about in the first place, or to ask about certain claims or that sort of things. But you could certainly set up that account, and then you would have access to that. And unlike the paper forms, if mom goes to the doctor today, we might not get that paper statement for a couple of months, depending on what the cycle is. But if you've got an online account, that information will be available within 24 to 48 hours, that you can see the details of that. So much more quickly in terms of a time frame to either, if you get in the habit of checking it once a week and you know that mom or dad didn't go to the doctor that week and nothing shows up there, like thumbs up, good to go. If that case is not, and something's there, then you're just aware of it that much sooner and can start the process of reporting that and getting it corrected.
So that's reassuring. Would my inclination as I'm listening to you, Ingrid, is if I'm caring for a loved one and I see something that doesn't make sense and they can't remember, I'm calling you.
Yeah. Absolutely. And if, we will walk through that. And then again, if it's, let's start with the provider. I mean, we always want to give providers the benefit of the doubt in terms of maybe it was an error. So we're not automatically always jumping to this has got to be suspected fraud, but oftentimes it is. But yeah, we'll absolutely, start at the beginning. If you're not sure and your person isn't going to be able to provide you with any additional information, we'll figure out what questions we need to ask and get to asking those so that we can fill out that picture. And if it's accurate, great. And if it's not, then we'll take the steps that we need to report that as suspected fraud.
So you will help me in this scenario decide what questions I need to ask of whom so that we can understand what the scenario is. Is that right?
Yes, absolutely. So if you open that statement and you see that there's all these different tests that were ordered that from the clinic, which was the clinic that your loved one goes to, and it is the provider, but you're wondering, like, what's the deal with all these tests? I mean, we're going to talk through that, and we'll encourage you to call the provider and ask for details about that. Like, you have every right, we all do as healthcare consumers, that if there's a claim that doesn't make sense or we need more or different information in order to understand it fully, then that's what you're going to do. And sometimes the clinic people, not huge fans of that, or they don't have as much patience as perhaps they could in helping us understand that, but that's their responsibility. And if they're unwilling to do that, that could be a red flag too, that something is maybe amiss in the way that they're billing, and they don't want to provide you with that information because there might be uncovering something else. Again, that's not where we jump to immediately, but if we're getting a lot of pushback or people aren't willing to help, then we start to wonder about that. And then we'll report that, and someone else can investigate at a different level and get some answers.
Okay, so give me the pep talk. I don't want to deal with cranky people. I'm not sure I even know what I'm asking about. Give me the pep talk, Ingrid. How do I get my head straight on I'm not making this life difficult for somebody else. I'm not being a witch with a bee, right? So prep me for that phone call.
Sure. So you're going to make a phone call and just being pleasant and just asking, hey, I'm helping my mom take care of her medical bills and things, and I'm going through some paperwork, and I've noticed some things on here that I have some questions about. Would you be the person that I would speak to, or is there someone else? And then kind of going from there, you're going to have that paperwork, if you can have that with you, so that you can reference claim numbers or some of that specific information that's outlined on that claim. And then you would be able to just, start at the top. Can you explain to me what this is and when this would have happened? Are there notes that, like whenever we go to the doctor, we come back with handfuls of paper and instructions and this and that. Maybe mom or dad didn't get them or didn't know what they were, or threw them out or left them at the clinic or whatever, but you can ask for copies of that information so that you can kind of go through it step by step to put some of those pieces hopefully together. And, just wanting to make sure everything's on the up and up. You're wanting what's best for your mom or your dad or your loved one. So I think, just going in there with a pleasant tone, you're not accusing them of anything. You're just wanting to get some more information so that you have a full picture of that. And then depending on what you're told, sometimes, people will call us back and say like, okay, that didn't go very well. Or I talked to someone in finance and they told me I couldn't get that information and they passed me on to someone else. And I've been waiting a couple of weeks and no one's called me back. Like, what do we do? Sometimes we'll call together. I don't think that we're threatening in any way, but somehow, we've got patrol in our name. Oftentimes people assume we have badges. We don't have badges, but we're a part of the Senior Medicare Patrol. And sometimes that maybe will help get some answers or get some return phone calls if necessary.
Very, very useful and helpful information. Before I open it up to questions, comments, stories from our guests today, what recourse do beneficiaries or their caregivers have when fraud is detected? You said you do all the investigative work and we can report that. What's the likelihood, percentage-wise perhaps, of being restored and having those monies refunded or somehow being made whole?
Well, I don't have great numbers for that at the moment. I said 60 billion on an annual basis is the amount that's frauded or errors, all the things gathered to the Medicare program. And recoveries back to the Medicare program are in the low billions. So it's certainly not a direct match, but I still think it's really important for people to report that because we're hearing takedowns, that's what they call them at the national level, on almost a regular basis for one sort of fraud or another. So they're definitely, on the trail for that. And in terms of, we want to make sure that your mom's Medicare account is secure. So we'll do all the investigation, but we're really going to encourage you to request a new Medicare number so that whoever has that isn't going to be able to use it any longer. Like that's first and foremost. And then, the investigators, they will, you've provided all the issue or all the hot points to the story and the related documents to support that. We're going to pass that on and then leave that to the investigators. And, a lot of times people will call and say, I know that I'm not going to, this isn't going to impact me, but I want to make sure that this doesn't happen to someone else. And so they want to, kind of paying it forward to the next guy, because if my report of this company ends this company's ability to continue to take advantage of the Medicare program, then that means that other people aren't going to have interactions with this company. Yes, there are other companies, but this one's not going to happen any longer. And so, people really feel empowered to make that report. And it's pretty painless. I mean, we will work with you to get copies of statements. I usually send people self-addressed stamped envelopes that are coming back to me. If they're not able to make copies, I'm willing to make copies when I receive them and send back the original copies. So we try to make that as easy as possible so that it's not a burden to someone who's like, oh, I reported this and now I got all this work to do as a result of that. So we're aware of that and want to try and make that as easy as possible.
Again, so very reassuring. I think what you said, Ingrid, for caregivers particularly, who have best interests of our loved ones at heart, when you discover something like this, to mention your statement, it's embarrassing. People don't want to talk about it, but there's a really important reason why you should. And that is, to your point, to facilitate the takedown of these bad actors.
Yep, absolutely.
Well, I'm finding this absolutely fascinating. I do want to provide an opportunity for those who are with us this evening to unmute yourself, ask a question, perhaps share a story, anything you would like to add here.
All right, I gave it a beat. Hi, Ingrid. If anybody's doubting it, I brought my box. There they are. So one of my loved ones got the test. The other one just got charged. So I have two relatives who are both managing this. So my question would be, so what do I do with all these COVID tests? Because when I first told you about them, I had all these good intentions of sending them back, but now I don't think I want to.
Definitely don't send them back at your own expense. I would not encourage you to do that, or your loved one or the person that you're providing care with. We've had a lot of people ask that question as it relates to the COVID-19 test kits that they received that they didn't order. And if they're not expired and you could use them, great. If there are other people that could use them, great. And if not, just get rid of them. I know that seems wasteful, but you don't want to trip over that box of tests for the next however long. And so it would just get rid of them.
So would you say that it would be a good idea or a bad idea to call those providers?
I would say that you could certainly try, but from the experience that I have, oftentimes when the providers are sketchy, for the lack of a better word, they provide you with a toll-free number to call for questions or whatever, but they're not really great at A, answering that phone number,
Mhm.
or returning any phone calls. So oftentimes we'll hear from people and they'll say, I called and called, they're never going to call me back. And you know what? They're never going to call you back. Medicare says you have to provide this toll-free number. I guess the other detail was they don't specify that you have to use that number and return phone calls. So very rarely do the companies ever respond. Or if they do, they're going to promise you a return label that you could wait forever to receive. So, I mean, if you feel comfortable, if you want to do your own due diligence to like close the loop on that, like, hey, I tried, by all means, but don't spend a whole lot of time doing that, or you might drive yourself insane.
I think that's what I anticipated. So if I were to call Medicare directly as the caregiver, is there anything special I need to do before I contact them? Or do I really have to have the loved one in the room with me?
You would have to have the loved one in the room with you if you were not the healthcare power of attorney.
Okay.
And you would also, when you call Medicare, if you've never called Medicare before, it starts out as kind of an animated system. So you actually have to plug in your Medicare information, and then it's going to prompt you to verify your name, the address that's on record, your date of birth, and then the start dates of Part A and Part B, which would be printed on the Medicare card as well. So, and they just ask for all of that information up front to make sure that it's really you or the person that you are representing, and it's not some phony trying to get access to that information. So that's why sometimes it's intimidating when people call the first time. They're not realizing that they have to provide all of that information. So when we're giving pep talks for people who are going to call Medicare, we just encourage them to have their Medicare information at their fingertips so that when those questions or those prompts happen on the phone, they're prepared for that.
All right. And if I am medical power of attorney, that makes a difference?
Yes, they will talk to you about that then. But you also then do need to have all of that information available so that you can, that you're the legit person asking questions about that person.
Wonderful. And I forgot to put the link to the website in the chat, which I will definitely do.
Oh, perfect. Thank you.
There we go. Thank you.
Absolutely. So yeah, on our website, there's a lot of resources that are available. We publish a quarterly newsletter that has just different information about Medicare related fraud and other topics that might be of interest to people who are Medicare age as well as their caregivers. You can request to be added to the newsletter distribution list. You can request one of our healthcare trackers. If you're part of an organization or a support group or another group and you would find it beneficial for someone to come and speak to your group, either in person or virtually, you can request that participation from the website as well, or you can always call our toll-free number for any of those things also.
Fantastic information. I do have a question, Ingrid, about POA and how you would, what proof they need from you on a phone call that you are. Do you need to scan and send documents? How do you verify that you truly have that power?
I think that you do need to scan and send documents to them to have that information on file. Then once that information is on file, were you to call again, they'd already have that information. I mean, you would still need to identify yourself and have your loved one's information available, but then they would have scanned copies of that documentation attached to the Medicare account for that person, and then that would be all set. So I can't just call and say, hey, I'm the healthcare power of attorney for Susan, and I want to talk to you about her Medicare. Like that, you can't do that.
So this is an important step for caregivers to know that once that power of attorney has been executed, or whatever the word is, you need at that time to make sure that those documents go to all of the providers for your loved one, correct?
Yep, absolutely. So that's on file, so that there's never going to be a pause or a disruption of service or of care ultimately, because the documents aren't in place. So make a lot of copies of that, or ask at the healthcare provider to help with copies, to make sure that, you know, the insurance companies and all of the people that would need access to that have that on file, so that that doesn't become an issue when you're in crisis. Hopefully you're not, but if you are, you're not sent home to rummage through things to find copies of that stuff.
Which we've done.
Oh yeah, we've done that, and we know that we could help ourselves by doing that, but that's not always top of mind.
So is it sufficient to send that POA documentation to a primary care physician and ask that physician to provide it to other sub-providers, or do you need to get those sub-providers perhaps from the primary care and make sure they all have the documents?
That's a good question. I'm not sure that I am able to fully answer that. I guess I would definitely start with the primary care provider and ask the question if they're able to provide some assistance in helping to make sure that all of those entities, because, you know, with the electronic health records, all of those systems ideally talk to each other. So it may be that once that document is uploaded into the system, whoever else has access to that would then be able to see that information. But a good clarifying question to ask the healthcare provider.
Yeah, I think about, you know, gee, a cardiologist, a urologist, some of the rheumatologists, whatever all of those sub-providers might be. Is it also important, Ingrid, to make sure that your loved one's dentist has that information?
I would say yes. I mean, I think it certainly doesn't help if there's ever an emergency or some issue with dental care. I mean, that would be the same situation as, you know, any other sort of healthcare provider, that if permission was needed to do a treatment, or, you know, whatever the case may be, that if that person is not able to make that decision for themselves, that they would know who was and how to reach them.
Well, this has been absolutely phenomenal. Last chance, everybody, if you have a question for Ingrid, perhaps a story you'd like to share before we sign off.
I'm just going to piggyback on the power of attorney with the providers. I've found a lot of success with a lot of the groups. So the Pro Health Cares and the Auroras, and once you get it into the system with one of them, it's usually takes with the rest of the providers in those networks. But yeah, the dentist, no, you'd have to do it separately. So I was always prepared with that paperwork. But it just seemed to get a lot easier. So once the primary had it, getting an x-ray didn't seem to matter. But that was in the same system.
Sure.
Good to know. So before we wrap, Ingrid, one last word of encouragement, advice for our caregivers, not only who are with us this evening, but who may see this chat at some time further down the road.
Sure. I would just say, if there's ever any questions or concerns, that we're here to help, that the Senior Medicare Patrol Program is here to help and guide you, to provide assistance, support, resources, whatever it is that we can do to help you, so that Medicare related fraud and abuse doesn't continue to negatively impact you or the person that you're providing care for. And so we don't want you to be embarrassed or ashamed, or, you know, we're not, like I said earlier, there's no judgment. It happens to the best of us. And so we're going to do whatever we can do to stop what happened and make sure that it's not going to happen again. And then we can go back and, you know, get things reported or fixed that happened previously.
Ingrid, thank you for that encouragement, that reassurance. This really is what compassion is all about. Thank you so much for joining us this evening. This has been really informative, and I know it will continue to help people who watch this further down the line. A reminder, this has been recorded, will be uploaded at susanamarshall.com in the Compassion Chat archive. So again, Ingrid, thank you. Wonderful information. Thanks for the work you do and for joining us this Halloween evening.
Absolutely. Thank you. And thank you so much for having me. It was a pleasure.
Wonderful. Night, everybody. See you next month.